Welcome, good morning. I'm Wendy Peterson. I'm the director of the Senior Services Coalition of Alameda County. And on behalf of our coalition members and our steering committee, I would like to welcome you here today to Making a Difference. I want to thank some of the people who made today possible first. And first I'd like to thank our partner, Alameda County Social Services Agency, and thank our sponsors, Alameda County Healthcare Services Agency, Kaiser Permanente, and Alameda Alliance for Health. Without their support and assistance and generous money offerings, we wouldn't have been able to make this day possible. So a number of representatives from those organizations are here in the audience, and I'd just like to give them a round of applause. Thank you. So I'm really glad that we have so many partners from the community here today. We have people from the villages, we have people from United Seniors of Oakland and Alameda County, and from the pool of consumer champions. And I know that they will help us remind ourselves that their experience is what counts when we talk about improving health and life outcomes for older people in the county. So thank you for being here. And I also want to thank the volunteers who are here today. We had a heavy lift this morning and you did a great job, and I also want to thank my awesome staff. Before we get started, there's a little bit of housekeeping. You should have received a program. If you don't have it, they're on the table over in the corner. And that includes the agenda, the speaker bios, some details about the video that we're about to show you, and descriptions of the discussion cafe topics. You should also have printouts of the panelists' presentations and handouts. If you don't, they're over in the corner. Take one of each. Our keynote speaker's presentation will be up on our website along with all the other materials. And the web page address is in your program on page 7, along with the information about Preservation Park's Wi-Fi. You can use that if you want to access Wi-Fi today. This is the 4th year for our conference, and each year we've used the convening to bring our silos together to talk about how we can make a difference in the lives of seniors in Alameda County. Last year we convened just after the election, and I remember saying to you all, we're still here, we're not going away, and we have a lot of work to do. Well, so over the last year, so much positive work has been done, and we wanted to start the day with a video showing you all of the innovations and the change efforts that are happening in this county to move the dial on improving health and life outcomes for older people. But the list quickly grew into a compendium, and we couldn't possibly capture it all. And so we just decided to capture a few and show it to you. Oh, go ahead.
So Alameda County Care Connect is a pilot project now in the end of 2020. And it's a whole person care pilot. So what it means is we get a chance to sweep away during this pilot the different silos that our care is broken up into. About 3,000 folks who are older seniors who we're looking for as part of the project. When we find, let's say, Joe, who's somebody who has a mental illness and also kidney problems and is currently living outside, what we're able to offer Joe as part of this program is we're able to find him, because there's outreach work. That's part of it. We're able to talk him into trusting us enough to come in and apply for the different housing options that are available, and then have housing navigation to help him get from the street into a safe place to live. And then at the same time as we're working on that, we're going to be working on gluing together the different aspects of care that he needs to really reach a place of wellness.
I'm Angela Ball, and I'm the Director of Public Health Nursing at the Alameda County Public Health Department.
I'm Michelle Bergen. I'm the Public Health Nurse Supervisor for our new pilot program, Older Adults Healthy Results.
The Older Adults Healthy Results program is a nurse case management program, right? So there are public health nurses who are going to be going to the homes of individuals who are 55 years of age or older, who have complex medical conditions, right? And they also have a lot of psychosocial challenges. and they're at risk for negative health outcome. And so the work that the nurse is going to be doing for them or with them is to ensure that they have a better improved quality of life and that they're better able to manage their healthcare condition.
Daybreak has partnered with emergency medical services and with St. Mary's centers, and we designed a pilot that is putting a system of rapid response case managers in place. We were thinking that these case managers needs to be as resourced and as equipped as first responders, and to be some kind of a psychosocial first responder in order to be able to address the complex needs of these high utilizers of the emergency medical services system.
Our initiative is called the Alameda County Palliative Care Initiative under State Bill 1004. This is the first time that Medicaid will recognize palliative care as a separate specialty and a separate service that's delivered. An opportunity to, one, define the members who would benefit from palliative care. Two, really create or expand the network of providers of palliative care. And three, it offers us an opportunity to partner deeply with agencies and programs in Alameda County.
It's called the In-Home Supportive Services, or IHSS Bridge Project, and is a project that's attempting to build a better bridge for people currently homeless who could benefit from in-home supportive services in it.
Our project is trying to identify homeless older adults who have disabilities and functional impairments who might need caregiving, but right now, because they're homeless, aren't able to access those services. And what we're trying to do is get multiple service providers involved, basically help bridge them over from homelessness into housing and into IHSS services.
Our project is called the Alameda County Council for Age-Friendly Communities. We're hoping that by bringing together people who are doing very important work at a large scale, that we can start working together more effectively.
I'm really happy to share information about Measure A1, which is the affordable housing bond that Alameda County voters passed by over 73%. There's a very significant program for seniors and people with disabilities as the focus, which is our home preservation loan program, which will have $45 million to support lower income current homeowners, but they can't afford to maintain the home or to make accessibility improvements that will help them remain safely and affordably housed.
Health Homes is a community-based model of care that links caregivers together for person-centered care, focusing on people with multiple chronic conditions. Our goal is to help people throughout these complicated transitions, from the hospital into a skilled nursing facility and back into their home. We've aligned with our providers and community resources, tying together community and social services through new types of linkages, including housing and behavioral health.
The community health home is designed to serve the most frail, hardest to reach seniors and persons with disabilities who have chronic mental illness, chronic physical illness, and even homelessness. The program is multidisciplinary. There's physical therapists, social workers, doctors, nurses, and the program is designed to provide enhanced case management for people struggling with their disease. And the hallmark of the program is having a nurse navigator or health navigators follow the patients to their home, doing home visits, following them to the emergency room if that's needed, or even following them to the hospital and meeting with the social workers or the discharge planners to ensure that there's a seamless coordination of care and it's also person-centered.
There's so much content that we weren't able to put into 5 minutes, and thank you to everybody who participated in this. I know that it was a little hard to hear some of that. You know, you can do a lot with an iPhone, but there's only so much. We're going to have this video up on the website, though, so you'll be able to watch it again and hear it well. So we couldn't capture it all in a single page that's in your program either. And we didn't even begin to try to capture the many advocacy efforts that have blossomed in this county to fight to protect the programs that seniors rely on. If you know of initiatives, community efforts, systems change initiatives that are happening locally, that are underway. Please feel free to share it today over on our community wall. There are some Post-it notes, you can write on them, just pop it up there. You know, maybe something that we know about and it was on our list and we couldn't share it, or it may be something that's new, so please feel free. So the takeaways, I think, the takeaways from this video, change is happening. Change is happening here and we are making it happen and we're doing that together. But the question that I have is, how do we take it to the next level? Where it's more than an assortment of innovative pilots, where it has deeper and lasting impact. How do we overcome the institutional and the social structures that keep us in our silos and that disempower and isolate people? And how do we reshape our public systems and our communities to be relevant for older people, no matter how old we are? Today we're going to be asking these questions. And I hope that each of you will take this very personally, because we are becoming an older society. And it's time for us to think about that as we work together to develop a community. Not silos, not individual cool programs, a community. Because it's the strength of that community, it's our connectiveness that will determine the extent to which we can weather the forces of political and policy change. And will determine whether we can really shape a local aging ecosystem that works for everyone.